Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery Wisdom Teeth and Denture Implant Center, and I wanted to go over all-on-four recovery. So you're thinking about getting an all-on-four done, and you're worried about basically what's my recovery process going to look like, or you've already just had your all-on-four done and you're experiencing some things and you're thinking, is this normal? Okay, so all-on-four. Typically, what we're doing for an all-on-four surgery is we're taking out your teeth, we're smoothing down your bone, and we're placing the dental implants and we're putting this prosthesis on, right? So that's what you're gonna do all on day one. Now, the only difference that you can see is maybe you already had your teeth missing, you've been wearing a regular denture and you're converted to an all-on-four. Okay, so regardless, that seems like a lot of work that we're doing that day. And so in regards to what to expect for pain, everybody's different, so they have bell-shaped curves, right? So most people are kind of like in the middle of the bell. And I've seen, done tons of all these like all-on-fours, these snap-on dentures, and everybody's pain experience is honestly very different, and I honestly can't predict that for you. One thing I can honestly ask you is like, hey, what's your pain tolerance normally? So I've had patients that literally popped a few ibuprofen after this whole procedure, and I've had other patients that ask me for hydrocodone for 2 weeks because they just are in more severe pain, and it seemed like a lot of work that was getting done. So again, I'd ask yourself, hey, what's your pain tolerance normally? So that's what you would be experiencing from a pain perspective. Now, what's another factor that comes in regards that's associated with pain is typically swelling too. And so some patients just are more prone to swelling. I've been doing surgery for 10 years, whether we're doing wisdom teeth extractions, other dental implants, all on fours, again, snap-on dentures. Everybody swells differently. So how much bruising do you typically have too? Now, the cool thing about swelling and bruising is that if you are more prone to swelling and bruising, what we can do is that we can actually give you something called an oral steroid, a Medrol dose pack 24 hours before your procedure. And if you start taking that, again, 24 hours before your procedure, and when you follow the recommended regimen, you can have significantly less swelling. That's going to benefit you because the less swelling and bruising, the less pain that you're going to have. So that's a really cool thing about the recovery process. Also, in regards to medications, so here at North Texas Dental Surgery, now everyone's different. I've seen some oral surgeons that are like non-opiate practices. I've seen other offices that will give you opiates, pain medications, but every doctor is different. But typically, what we do here for our protocol is we give you your antibiotics. If you're not allergic to penicillin, we love to give you Augmentin for this procedure. We think it's just a fantastic antibiotic. Also, what we'll do is we'll give you ibuprofen. I don't care if you're not in pain. I love ibuprofen because of its pain relieving effects, but also its anti-inflammatory effects. So I want you popping that every 800, ibuprofen 800s every 6 hours, whether you're not in pain or not. Also, on top of that, if you do have more severe pain, we also give our patients hydrocodone. In various, very, very, very rare instances where patients are in more severe pain, we give oxycodone. However, I don't remember the last time that a patient has actually requested oxycodone from us. So again, that's the typical regimen that we give for patients during the recovery process. Now let's talk about bleeding. In regards to bleeding, you're going to have some definitely for the first few days. Now you might see a little bit of oozing, and also if that mixes in with saliva and you have your gauze in your mouth, we want to let you know that's totally normal. It is just cases where you see blood pulling up in your mouth that you definitely want to be more concerned and you want to contact your surgeon. Again, that would be very rare, and no surgeon would ever send you home with that amount of bleeding. So just to let you know, that's what to expect for bleeding. In regards to oral hygiene, basically what we want you doing for the first month is a lot of saltwater rinsing, whether a teaspoon or half a teaspoon of salt in a cup of water. Rinse 30 seconds, spit. Do that 2-3 times a day. Also, I still want you to clean this prosthesis with a toothbrush, soft toothbrush, and a non-abrasive toothpaste, a non-whitening toothpaste, because that can actually scratch up the temporary. So that's really important that you do that for the first month. And then at the first month appointment, we give you further guidelines and we introduce the water pick at that point. But again, focusing on the recovery aspect, we only focus on the first month. Now, last thing that we want to talk about is numbness. Now, you can experience some numbness, especially with a lower all-on-4, because you have something called the mental nerves down here. When we're going there and we're taking the teeth out, we're reducing the bone, there is quite a bit of manipulation of your gums, and you have a major nerve. It's a sensory nerve. But long story short, because of a lot of manipulation of your gums and working around the site, you can experience some numbness in the affected area. So that should be temporary also. So hopefully you guys found this information to be helpful. If you guys have any questions, please feel free to leave a comment below or feel free to make a consult with us, and we're glad to answer any questions for you. Thanks.